Peripheral artery disease and coronary artery disease are two circulatory conditions that each affect millions of Americans. It's important to learn about both of these conditions so you know your risk and can take proper action. Let's start with coronary artery disease, or CAD. CAD is a buildup of fat, cholesterol, and other substances which form a plaque in the arteries that supply the heart with blood, the coronary arteries. CAD is the most common kind of heart disease and affects over 18 million people in the United States alone. But what leads to these plaque buildups and puts us at risk for CAD? There are several factors that increase risk, and many of them are related to each other. This means that working on one can also improve other parts of your lifestyle. Factors include level of exercise, smoking, diet, diabetes, age, family history, blood pressure, blood sugar, blood cholesterol. CAD can show up in many ways. The most common is chest pain, but other symptoms can include back pain, weakness, or shortness of breath. Women may experience heartburn or nausea. CAD can be treated using changes to your lifestyle, supervised rehabilitation programs, medications to reduce risk factors, and surgery. Now let's take a look at a similar disease. When plaque builds up and limits blood flow in the arteries that supply the limbs, often the legs, it is called peripheral artery disease, or PAD. About 8 to 10 million Americans have PAD, and certain demographics, such as Black Americans, have a higher risk of developing PAD. Approximately 1 in 5 Americans over 60 have PAD. Since both PAD and CAD are caused by plaque buildup, it is possible to have the two conditions at the same time. In fact, having CAD may increase your risk of developing PAD. Approximately 42% of patients diagnosed with CAD also have PAD. The risk factors for PAD are similar to CAD, including diet, smoking, and nutrition. Having diabetes is also a risk factor for developing PAD, as is age. Do you get pain or discomfort in your leg or buttock muscles when walking that goes away with rest? Do you have discoloration on your feet? People often report they have trouble keeping up with others. Sometimes, initial symptoms are brushed off as normal signs of aging or attributed to other factors. However, feeling pain when moving is not normal and should be reported to your provider right away. It's important to note that approximately 50% of people with PAD will not have classic symptoms like leg pain, and severity might differ from person to person. Treatments for PAD are similar to those for CAD and include lifestyle changes, exercise therapy, medications, and/or surgery. Even if you take medication or have surgery, certain lifestyle changes can still be beneficial and can prevent further issues. It is important to understand the pros and cons of different treatments. The potential benefits and risks of certain treatments may be better for you than others. Prompt treatment can reduce the chances of undesirable outcomes. For example, CAD can lead to a heart attack, and PAD can lead to foot or leg amputation if untreated. These diseases are serious and much more common than people realize. That's why you should talk to your provider as soon as possible about your risk and how to decrease it. Make sure your provider listens to you and evaluates your symptoms. Walking is a proven way to help decrease the symptoms of PAD. Sometimes you have to walk and experience the pain in order to improve your condition. Talk to your doctor about starting a walking program and what resources are available to you. If you don't have adequate insurance coverage, consider using free or low-cost resources in your community to get screened for CAD and PAD. Talk to your doctor now. advocating for yourself can save your life. Recognizing the signs of PAD and CAD can be life-changing.